those who have the textbook of nutrition science, it's on page number 174. The latest edition, it's on page number 174. Others, please refer to your indexes. I guess all the new students would have received the latest editions. So there is a slight change from now onwards. Please keep that in mind. All of the doubts which you have, that is kind of personalized, okay, little bit deviating from the topics and based on medical laboratory test based answers and all. For that, please contact me personally. Do not ask such questions in the open forum, okay, because certain answers should be given by doctors themselves on the prescription basis. So I will be directing you towards Dr. Pawan Mittal for that. Okay. Generalized doubts you can ask. Other doubts, please contact me on my personal contact number. I will share that at the end of the session. Okay. So that all the generalized doubts will be cleared. About the books and everything, please do not comment in these sessions. Okay. That is why every day I tell you my personal number. I ask you to contact me. Okay, at the end of the class, I will be sharing my personal number. Please contact me regarding your books and what is a tracking ID and etc. I will tell that in the personal forums. Okay, not on the public forums. Page number is 174, Nutrition Science textbook, macrominerals. So macrominerals are basically there are macro and microminerals. Microminerals you require only in trace amount, and macro minerals you require them in larger quantities. Okay, for example, let's say about calcium. Okay, calcium you require on a day-to-day basis as an adult. Okay, as an average healthy adult, 1000 mg, at least 1000 mg should be there at least. Okay, in certain chapters they have given 600 mg, and then they have updated, the ICMR has updated it into 800, and still the updation is going on, and now they are saying it is 1000 mg. Okay, so you can understand that 1000 mg, where is 1000 mg and where is uh, 15 or 20 mg of iron on a daily basis. So that is why we segregate the minerals as macrominerals and microminerals. The minerals which you require in much larger quantity, we consider them as macrominerals, and the few examples of macrominerals are calcium, phosphorus, magnesium, sodium, potassium, chloride, and sulfur. Okay, in this chapter we will be discussing only about calcium, phosphorus, and magnesium. Sodium, potassium, and chloride we have covered in our electrolyte balance, etc. Okay. Then microminerals, you have iron, manganese, copper, iodine, zinc, cobalt, fluoride, and selenium. Very trace amount you require. Okay, very trace amount you require in your day-to-day diet. So this is a basic difference between macro and microminerals. So first, let's start about calcium. With calcium, they say that an adult man of at least 60 kg, okay, a 60 kg adult, not just man, or female also, okay, nearly 1 kg of their body mass is made up of calcium. Okay, nearly one. Am I audible to everyone? Is my voice audible? Okay. Yeah. So in an adult body, okay, whatever your weight may be, if you're an adult person, if you're a healthy adult person, nearly 1 kg of your body mass, body weight is solely because of the mineralized calcium. Okay, not the iron, but the calcium in the mineral form. Calcium in the iron form is found in your blood, okay, circulating blood. 1 minute. Yeah, sorry for that interruption. Still people are joining. Yeah. So calcium, how the amount of calcium which is present in our body, you can see from the first statement itself. Okay, and out of this 1 kg of, or nearly 1 kg, 1 kg doesn't mean exactly 1 kg. It can be a little bit lesser than that or a little bit more than that. Okay, depending on a person's dietary constrictions, etc. So 90% of this calcium, 1 kg of calcium, nearly 1 kg of calcium, 99% of it is found in hard tissues. Can anyone give some examples of hard tissues in our body? Examples of hard tissues? Yeah, teeth, bones, okay, and semi-hard tissues like cartilage, etc. Cartilage comes under semi-hard. Yeah, so these are the hard tissues, okay, and rest of the calcium, that is 1% of the calcium, is found in blood, and in blood it is found as iron form, in iron form, calcium ions, and some calcium will be found in the soft tissues such as muscles, okay, muscles, liver, heart, etc., because we'll see about that in the function of the calcium. Okay, with that you will understand why calcium is also found in the calcium ions are found in the hard tissue, soft tissues. Okay, so this is the normal range of blood plasma calcium levels. Okay, it should be around 9 to 11 mg per deciliter. Okay, that's the normal blood plasma calcium levels. If it goes less than this, okay, if our blood plasma calcium level is less than 9, that is when you should realize that your bone is being demineralized to cover up for the reduced blood plasma calcium levels. Okay, so you have to maintain your normal blood plasma calcium level between 9 to 11 microgram per deciliter. So next we have bone formation. Okay, functions of calcium. The first thing is bone formation. So uh, these are the words. Can you see a small table here? It's written osteoid, osteoblast, osteocyte. Okay, hydroxy apatite crystals, etc. Okay, you just have to remember osteoblast, osteoclast, and osteoid. Okay, for the understanding of bone formation, how bone is formed in the body. Okay, in resting phase, osteoblast is something. Anything that ends with osteo, like site, CYTE. Okay, site means cell. Osteocyte means the bone cells that will differentiate, multiply, and calcify, and thus form the bone. But before you get osteocyte, there are osteoblast, which is already present in the tissues. Okay, and from where does this osteoblast come? They come from the mesenchyma cells. When you are in a fetal stage inside the womb, your body has certain tissues called mesenchyma, parenchyma, and all those things. So from mesenchyma, osteoblast will be formed, and as the fetus is developing within the womb, okay, these osteoblast will convert into osteocyte. And when osteocyte is formed, that is when calcium can come and deposit itself nearby the osteocytes. Mineralization can take place. Osteocyte can undergo differentiation, multiplications, etc., and thus you get the entire bone. So in resting phase, you have osteoblast. You can see only this blue layer, okay, and later, after, as soon as it gets activated, osteoclast reabsorption is taking place. Means it has started differentiating and it has started multiplying. Okay, and when the osteoclast has attained a certain level of multiplication, in the second picture you can see a small yellow colored area which is formed between the osteoblast and the tissue. Okay, a small yellow, this is the starting phase of the bone formation. This matrix, we call it as osteoid. Okay, osteoblast will secrete certain collagen also, the type 1 collagen, and some kind of protein enzymes, etc. That is too technical, no need to understand that. Okay, it is very technical and very, very anatomical and physiological kind of subject. So because we have a variety of students here, no need to get too technical about it. Okay, so you can see a small yellow color part which has been found here. So this is the osteoid. Osteoid doesn't have mineral yet. Which mineral? Calcium, phosphorus, and magnesium. Not just calcium, but our bones also have amounts of phosphorus and magnesium also. Okay, so this is a demineralized part as of now, and slowly when it gets mineralized, when the blood it is richly, all the bones are richly supplied with blood vessels. Okay, so as soon as the blood, which is rich in calcium, phosphorus, and magnesium, comes to this area, it will deposit the calcium, phosphorus, and minerals, and slowly bone will be formed out of the osteoid, because osteoid is an area where it is not that mineralized. It's a soft tissue. Okay, it is not mineralized with calcium, phosphorus, and magnesium, etc. So when it gets mineralized, that's when you say you have a bone. Okay, so this is how from small cells like this, which we call osteoblast. Okay, it converts into osteoclast, and slowly osteoid will be formed, and osteoid will get mineralized, and that's when you get a new bone. Okay, that's bone formation. And a bone which has to be completely formed, especially in the growth phase, it takes around 160 to 200 days to reach from osteoblast till a complete bone formation. At any point of time throughout your entire life, even as you live and breathe now, okay, there are these osteocytes, osteoblasts which are still active in your body. Okay, so that is why when you undergo certain fractures, okay, certain medical conditions like osteoporosis or fractures, your bone can reattach, but not to the previous strength, but it can still form again. Okay, so that is the reason why we have, it is because of the reason that we have certain active osteoblast still in our body. Okay, which is ready to undergo its differentiation, mineralization, to form new bones. Okay, or to strengthen a broken bone. Then the second function for calcium is tooth formation, obviously. So when a child is before you are born, when you are with a fetus in the womb, from around 20 weeks, okay, 20 weeks, it's like 5 months. Okay, when a woman is 5 months pregnant, from that time itself, the child she is carrying, okay, the deciduous teeth formation begins in the gums of that fetus. Okay, understand that the deciduous teeth is the milk teeth which falls out. Okay, then we, after deciduous teeth, we have the permanent teeth, and in later stage of the life we get the wisdom tooth. So as the fetus is inside the mother's womb, 5 months of my 5 months old fetus inside a mother's womb, at that time itself, deciduous uh, deciduous teeth has already begun its formation in the gums of this fetus. Okay, and slowly after birth, when the child is born, around 6 months, when the child has reached 6 months of age, that's when new teeth will start to erupt. Okay, and why this is happening? Because enough amount of calcium was deposited in the tooth sockets, etc., when the child was still forming inside the womb. Okay, so that is why it is very essential about the calcium supplements which the pregnant ladies should take. Okay, for adults, I told you it's around 1000 mg per day, but when you are lactating or when you are pregnant, it is around 1200 mg per day. Okay, because you have to support the calcification of the deciduous teeth of the child you are carrying. Okay, so that is the reason. One is that reason. Second is the bone formation of the fetus also. Next, when the child becomes around 3 years of age, okay, at that time, permanent teeth will start to calcify in the gums, and slowly the milk teeth will fall off. And when you reach the age of 8 to 10 years, that is when already in your gums, okay, already in your gums, your wisdom tooth has started calcifying. But when does the wisdom teeth erupt? That depends on various factors. Okay, it's not the same for all the adults. Some get the wisdom teeth in early, late teenage, early adulthood, and some get the wisdom tooth in quite midlife or late adulthood. Okay, so that depends on various other factors too. So that's how calcium helps in tooth formation. Then in growth, obviously, since calcium is such an integral part of bone formation, it is an integral part of your growth. Then in blood clotting, when you cut yourself, okay, your cells will release thromboplastin. Okay, this is too technical. Your blood will release thromboplastin, but thromboplastin has to convert into fibrin, because the scar which you see or the clot, after you cut yourself, okay, when the blood dries off, it becomes brownish dark in color. Okay, that is when the thromboplastin has been converted into fibrin. Okay, fibrin is something, it's a mesh-like structure that will completely stop the blood and the blood plasma from oozing out of the wound. So, what for the thromboplastin to become fibrin, okay, the blood should have calcium ions. In the absence of calcium ions, this will be delayed, and a delayed wound healing, a delayed blood clotting is quite fatal. Okay, so that is why how calcium is important, is an important factor in blood clotting, because of the presence of calcium ions in the blood, thromboplastin can be easily converted into fibrin. Okay, before thromboplastin finally becomes fibrin, there are many other small steps that is too technical. Just understand these two words, thromboplastin and fibrin. Your cells has thromboplastin as soon as they undergo certain cuts. Okay, cells undergo some trigger reaction, thromboplastins are released, they have to be converted into fibrin. So we require calcium ions in the blood to convert the thromboplastin into fibrin. So that's how calcium helps in blood clotting. Then contraction of muscles. Calcium ions are readily bound to all the proteins inside and outside the cells membrane, etc. So that is how they help in contraction and relaxation of the muscles, not just your regular body muscles, but also it's a very integral part of your heart health itself. The myocardium muscles, etc. It is quite important in that area also. We'll see that later. Then intracellular messenger, certain hormones require the presence of calcium ions so that it can be triggered. They can exert their action. Hormones can function in an optimum environment when calcium ions are present. Release of hormones like insulin, parathyroid hormone, calcitonin. Okay, these everything is facilitated by the presence of calcium ions in the blood. In the absence of calcium ion in the blood, the release, the secretion, okay, and the action of these hormones like insulin, parathyroid hormone, calcitonin is markedly reduced. Contact inhibition means two cells, they attach to each other, the way how two cells stick to each other. Okay, so calcium helps this kind of communication between two cells. Calcium helps two cells to stick to each other. Okay, so that's contact inhibition. Action on heart. As I told earlier, calcium ions will act on the myocardium and it prolongs the systole. Systole means when your heart is contracting and pushing out the blood. Okay, that time is called the systolic moment. Okay, and in diastolic is when your heart relaxes to fill itself with blood. Okay, so that's how we have systolic blood pressure and diastolic blood pressure. Systolic blood pressure means the pressure on the blood vessels when the heart was in the contracted state. Okay, and diastolic blood pressure means when the heart was relaxed, what was the blood pressure on your blood on your arteries in that state. Okay, so what happens when the presence of calcium ions, it prolongs the systole time. Okay, from few seconds. Within few seconds, it will prolong the systolic time so that more and more blood can be, more volume of blood can be pumped from the heart to the body tissues, etc. So that's how calcium acts as on the myocardium of the heart. Membrane integrity and permeability. Calcium ions will influence the entire structure of your cell wall, the cell membrane. Okay, and how many water should enter, how much of the water should exit the cell. Okay, how which all ions can cross it, which should be existing the cell, etc. That kind of control is exerted by the calcium ions. Activation of enzymes. So like ATPase and enzymes, dehydrogenase enzymes. For these enzymes activation, you require calcium ion in the body. Then coming to calcium absorption, a majority of calcium absorption takes place in your intestine, small intestine. Okay, so how does this take place? So calcium can directly pass from the food, okay, from the chyme which has reached the intestine. Chyme means the food which is mixed with your gastric juices, okay, the food that have just exited your stomach, your duodenum, and has entered the small intestine. We call it as chyme. Okay, so from the chyme, when the calcium has to get inside the enterocyte. Enterocyte means the cell of the intestine. Okay, enterocyte means cells of the intestine. Okay, so calcium has to get inside the enterocyte so that it can reach the blood vessels at the end. This red part is the blood capillaries. Okay, so one mechanism is the TRPV6. Okay, the full form of that TRPV6 is not given in the textbook, but it's a membrane. Okay, it's a membrane which is present on the enterocyte, which will pull the calcium ions inside. Okay, so the full form of TRPV stands for transient receptor potential vanilloid 5. Okay, that's the full form. You don't have to remember this because it's not given in the textbook. Okay, from the image which I got, it was mentioned like this. So because of this membrane will actively pull all the calcium ions inside the intestine cells, that is enterocyte. Okay, and within the enterocyte, within each of the enterocyte, you see this C-shaped orange curve. Okay, this C-shaped curves in orange color. It is called calbidin. Okay, calbidin, from the name itself you can understand calcium binding. Okay, calcium binding. So it is a protein. Okay, calbidin is a protein that will bind the calcium and travel with this calcium, and it will reach the blood capillaries finally, and that's how the calcium ions will be pulled from the food, from the chyme, travel through the enterocyte with the help of calbidin, and finally with the help of ATPase enzymes, calcium as well as magnesium, it will be together released into the blood circulation in the blood capillaries, and from there it will go to the veins, arteries, etc. Okay, and it will be taken to the various other body parts for its consumption. So that's about calcium absorption. Favoring factors for absorption, which factors can favor or increase the calcium absorption? First is the presence of vitamin D. Active form of vitamin D, we call it as 125 dihydroxy cholecalciferol. Okay, quite big name. Okay, but active form of vitamin D within the body, this is what we name it. Okay, so the vitamin D, it synthesizes and it regulates the calcium binding protein, which we have just seen, calcium binding protein here in form of calbidin. Okay, and it serves as the calcium carrier in the intestinal cell. So with the intestinal cell means enterocyte. So it is because of the calbidin, the calcium can move through the intestinal cell from the area from where it was absorbed to the capillaries, okay, to be released into the circulation into the capillaries. Okay, so that is why the presence of this active form of vitamin D can result in 10 to 30% increase in the calcium absorption. That is why we say always vitamin D and calcium. Okay, the presence of these two nutrients are quite important when it comes to bone health. you can't just depend on calcium, you can't just depend on vitamin D. Okay, they both function in harmony and help in each other's absorption. Okay. Next is the acidity of the digestive mass. We know the pH of the small intestine lies between 2 to 4, somewhere between 2 to 4, and that kind of pH is required for the active absorption of the calcium. If the pH of the small intestine is into the neutral side, or it's bit alkaline, the absorption will not take place. So you require an acidic environment in your intestine for the absorption of calcium. Lactose, when your lactose will favor the absorption of calcium, especially in infants. Okay, because lactose will make sure that the intestine has healthy intestinal flora. Okay, a good bacteria is there in the intestine, and because of this good bacteria intestinal flora, the pH is quite adequate for calcium absorption. Then you have protein and phosphorus. Protein will also help in, if your diet is protein rich, okay, you have a calcium rich diet as well as a protein rich diet. It's very good because this protein rich diet, the amount of protein in your diet, okay, that will help in the active absorption of calcium. But if your diet is calcium deficient, okay, in that case protein will not help in the absorption of calcium. Okay, so both has to be quite adequate. Both the in the intake of calcium as well as the intake of protein should be quite adequate. Then only protein can help calcium absorption. Otherwise, it will not interfere in the absorption of calcium. And also phosphorus also helps in the absorption of calcium. So in the book, they have given this statement: protein has no effect when calcium intake reduces to 500 mg per day. If your dietary intake of calcium is less than 500 mg per day, protein cannot help that absorption. Okay, protein cannot help in increasing the absorption. Then you have need for calcium. For example, your body is deficient in calcium, so there are certain triggers that will take place. First of all, your parathyroid hormone is the first thing that will come, put itself into action. Okay, well, as soon as it detects that in blood serum and blood plasma, the calcium levels are going down. Okay, so automatically, whatever calcium you are eating, whatever amount of calcium you are giving yourself via diet, the body makes sure that the entirety of this calcium is absorbed and nothing is excreted. It will also make sure that if in the kidneys, okay, usually when the blood gets filtered out, okay, calcium should be filtered out, but the kidneys will make sure that maximum 99 to 100% of the calcium which was supposed to be filtered out, it is reabsorbed into the blood circulation. Okay, so there is no wastage of calcium. So there are a lot of physiological changes that will take place when your body is going into a deficiency state of calcium. Okay, so depending on your need of calcium also, the body will take care of rising the serum calcium level. So now coming to the factors that will depress the calcium absorption or negatively affect the calcium absorption. First is oxalic acid. It has been seen that oxalic acid, which is present in foods like spinach, okay, certain green leafy vegetables, etc., they combine with the calcium ion and they make some insoluble complex thing which is impossible to be absorbed in the intestinal level. So oxalic acid along with calcium, they together make some insoluble mass which cannot be absorbed by the intestine. So what happens? Automatically it will be excreted from the body through feces. Okay, so that's how the foods that are rich in oxalic acid, so in that time calcium absorption cannot take place. Then you have phytic acid. So phytic acid is present in cereals, okay, and that will prevent calcium absorption, especially whole wheat flour, oats, okay, whole grain cereals, okay, the outermost layer of whole grain cereals, etc. They contain this phytic acid, and this will not allow the calcium to be absorbed in the intestine. So this is a depressing factor. So, but it has seen that when you the whole grains which has phytic acid, but the way how you are using these whole grains, are you fermenting the whole grains? For example, when you make bread, okay, when you make bread at home, when you use yeast and all to make sure your dough undergoes fermentation, etc. So in that case, the phytic acid's role can be reduced. Okay, fermentation will take place, especially in wet baking stages. So that will reduce the phytic acid, and because of that, it will not affect the absorption of calcium. In whatever food where you use yeast, yeast is supposed to secrete an enzyme called phytase. It's given that in the textbook, you can read that. Okay, yeast will secrete the enzyme called phytase. So phytase will um, metabolize phytic acid during the fermentation process itself. So it is no more affected. Then we have steatorrhea. Steatorrhea is a symptom in which you excrete large foul smelling stools, okay, bad smelling stools in large quantities, okay, and especially this takes place when you have food that is very high in fat, okay. When your food is quite high in fat, that's when your feces become large and foul smelling, okay. And because of this phenomena, your calcium absorption is certainly reduced, okay, because too much of fat in the food, that will not allow proper intestinal absorption of not just of calcium but of any other minerals. So it will be completely excreted from the intestine will not have much time to work on breaking such large quantities of fat, and from that take the ions, etc. Your body has certain limitations to that. So that is why when somebody is suffering from steatorrhea, it means that calcium absorption is quite low. Emotional and instability, people who undergo stress, tension, anxiety, grief, even boredom, okay, these kind of emotions can interfere with calcium absorption. It is certainly down when you are going through certain unstable and emotional conditions. In that case, your calcium absorption is quite down. Increase in the gastrointestinal motility. How can you name a food that will increase the gastrointestinal motility, which is good for your gut health, but to a limitation? Yeah, it's given in the textbook. Yeah, true. It's fiber. Okay. So fiber, always remember 60 gram of fiber you can have in food, but not more than that. This is the reason why. Okay. Too much of fiber rich food will make sure none of the nutrients are absorbed, because when it will increase your gastrointestinal motility, it will increase the peristalsis movement in your intestine. Okay, if these movements are increased, there is no time for your intestine to sit back and quietly absorb all the essential nutrients. Okay, so too much of fiber rich diet, automatically the calcium absorption comes down. And also when somebody is suffering from diarrhea, okay, rate of passing stools is quite high. In that case, not just calcium, but all the major electrolytes and other micro and micro minerals, all are lost in that excessive passage of stools, etc. Okay, so that will affect the absorption. Lack of exercise, especially the people who do not do weight bearing exercises, like people who solely are dependent on exercises like walking, okay, or like yoga, etc. It's not weight bearing, okay. The exercises that are not weight bearing, in that case, calcium absorption is reduced. Okay, weight bearing exercises will make sure that you have quite a good calcium absorption. Usually, I don't know specifically about castor oil, but any oil, any fat, or any oil taken in large consumption, it will lead to diarrhea. That has been observed. Okay, not just castor oil, but any oil that is taken too much, okay, in quantity, it will lead to diarrhea. Then you have aging with old age, with as your age progresses, the calcium absorption comes down. Okay, it is inversely proportional with aging. Then caffeine, high intakes of caffeine, a moderate intake is fine, but high intakes of caffeine will make sure that the bioavailability of calcium is lost. Okay, bioavailability means from the food how much your intestine can take in. Okay, if you're having um, a food that can give you 100 mg of calcium, okay, so but from how out of that 100 mg, not the entire 100 mg will be absorbed by the intestine. Around 90 to 95 mg could be absorbed. So that's what we call bioavailability. So when you have too much of caffeine rich foods, caffeine rich beverages, it makes sure that even the bioavailability is reduced. Then you have drugs, specific medications like anticoagulants, which you use like blood thinners, etc. Aspirin, people who are on aspirin, ecospirin, etc. Cortisone, thyroxine, these will reduce the calcium absorption. So these are the factors that will depress the calcium absorption. In details, brief explanation is given from page number 180 to 181. You can check that. Metabolism of calcium. Calcium is transported from you eat food which is rich in calcium. Intestine will absorb the calcium ions and put it into the blood circulation. Okay, in the capillaries, and from the capillaries it will go enter into the main blood circulation. Okay, from the blood, this circulating calcium ions will reach your extracellular fluid, the fluid that is present between the cells. Okay, not inside the cells, between the cells. Okay, so now the cells got the signal that surrounding them are the fluids that is rich in calcium ions. So cells will take up the calcium ions from this extracellular fluid. Okay, and it will use especially the most common destination for your calcium ions in your body are your bones. Okay, are your heart tissues. So 99% of the calcium, since the blood already has enough amount of calcium ions circulating, this blood will also reach your kidney where it has to undergo filtration. This blood along with the calcium ions will reach the kidney for filtration. Whatever calcium is filtered out, it is again sent back into the circulation. 99% of calcium is reabsorbed. Okay, it was supposed to be filtered out, but it is reabsorbed by the kidney and sent back into the blood circulation. Okay, and then even the reabsorbed calcium ions and even the calcium ions freshly which you have got from the food, both of this is mostly used by the bones for its calcification. Okay, because remember, any point of your lifetime, there exists osteoblast on the inside the surface of your bones, ready to be activated whenever it is required to help with the mineralization and strengthening of the bone. Then coming to the hormonal control. First is your parathyroid hormone. So hormonal control is required because the balance of calcium, okay, external internal balance of calcium is completely dependent on certain hormones, especially parathyroid hormones, 120, 125 dihydroxycholecalciferol hormone and calcitonin hormone. Okay, so especially these three hormones will regulate the amount of calcium, how much it should be there in your blood plasma, how much should be excreted out. Okay, how much should go into mineralization of bones, and should we demineralize the bone or not. Okay, everything is controlled by all these hormones. Okay, especially this parathyroid hormone has a very important function with relation to calcium. So as soon as the blood plasma in the blood plasma calcium level falls down, okay, usually it is because of dietary deficiencies. Okay, and your parathyroid gland will be triggered. and it will secrete parathyroid hormones. And what these parathyroid hormones will do, it will function in various ways. Okay, so the first way is within few minutes of its secretion, it will inform the kidney to do the reabsorption. Do not waste a single ion of calcium via urine. Okay, that is the first thing your parathyroid hormone will do. It will signal the kidney to increase the reabsorption of calcium. Do not excrete calcium ions. Okay, second thing, parathyroid hormone will lower the serum phosphate level. It is similar to sodium and potassium. Okay, it is seen that high level of phosphate, okay, phosphate in your serum, high phosphate levels in your serum will decrease the calcium levels in the serum. So what the parathyroid hormone does here is it will make sure the kidneys are excreting lots of phosphate ions. Instead of calcium ions, kidneys are excreting lots of phosphate ions. So what happens, automatically the phosphate level falls down and the calcium level increases. So the serum has almost not equal to normal, but not normal, but slightly normal calcium levels. Okay, it has not gone into the deficiency state yet. That is the second thing the parathyroid thyroid hormone will do. Third thing is it will trigger the bones to release calcium ions. So demineralization of the bones will take place. So bones will directly release the calcium ions into the blood circulation, and automatically the blood calcium levels will rise up. And also the final thing, okay, that will take time, but the final thing the parathyroid hormone does is it will stimulate your small intestine, to absorb maximum amount of calcium. Do not waste any of it and send it into becoming feces. Okay, so these are the four ways in which parathyroid hormones make sure that the calcium level in the blood plasma, in the blood serum, doesn't fall down. Okay, next we have calcitonin. So calcitonin is released by your thyroid gland. Okay, parathyroid hormone, from the name itself, we know it is from the parathyroid glands. Calcitonin is secreted by the thyroid gland. As soon as the calcium serum plasma calcium levels is too high, hypercalcemia, okay, is too high. So calcitonin will lower the plasma levels just by sending these calcium ions into the bone from the blood. It will trigger the blood to deposit the excess calcium ions into the bone. Then vitamin D, it is the most active form of vitamin D, that is 125 dihydroxy vitamin D3. Okay, so that is the most active form of vitamin D present in your body. So it will make sure that there is an enhanced intestinal absorption of calcium. If enough amount of vitamin D is not available in the body, good absorption of calcium will not take place. Then you have cytokines. Cytokines are like part of your immunity. Okay, these are the immune cells. Cytokines are an example of immune cells. So they will make sure that bone reabsorption, okay, takes place. Bone reabsorption means whatever minerals the bone had to lose because when the blood plasma was low, that amount of calcium ions is supplied back into the bone. So next you have a topic called osteoporosis and female athletic triad. Female athletic triad in one class I had explained. Okay, I will explain it later in that particular class. Osteoporosis, I request you all to do a self-study on that. It's a very important topic. Please read through that. If you have doubts, please reach out to me. Okay, it's a very important topic. I'm not taking it now. I will take it later. But before I take the osteoporosis class, I request you all to please read about it. Okay, it's a very common disease condition which we are seeing on a rise. Okay, especially from you are not seeing osteoporosis just because a woman has reached the age of menopause, but even before that we are seeing many cases on rise. Okay, even the women who are in their mid 30s, okay, in midlife and still menstruating, even osteoporosis is seen in those women. So that is the reason why these cases are too high now. Please read this particular topic from page number 184 to 192. Okay, it will include the female athletic triad also, what kind of food you have to give. Okay, what are the technical details about that? Please read through that. This is your self-study assignment which I'm giving you, so please read that. Osteoporosis is very important. I'll take that class later, but before that, I want you guys to have a basic idea of this particular topic. So coming to hypocalcemia means reduced calcium ions in your serum. Okay, blood serum. So inadequate calcium ingestion is the main reason. Okay, and if not just inadequate dietary levels of calcium, but also people who have undergone certain surgeries on their thyroid gland. Okay, and if too many of their parathyroid gland is cushioned behind the thyroid gland. Okay, and if any thyroid surgery is done, especially people for women and men who suffer from diseases like hyperthyroidism, etc., in that case, when thyroid surgery is done and some part of the parathyroid tissues are also lost in that surgery, those people have a chance of getting hypocalcemia. And also people who have some certain inborn errors of metabolism and also some malabsorption syndrome, especially for calcium, you see this condition there. And what are symptoms which you see in hypocalcemia is because mostly it is neurological, nerve related sensation like tingling, numbness. Okay, you will not feel the endings of your peripheral extremities. Okay, the sense of feeling and touch sensation, tactility, what you have at the peripheral extremities, etc., that will be going away slowly. Okay, and there will be spasms, involuntary spasms. You must have seen, you just rest your hand somewhere, but automatically you see your thumb shaking. Okay, involuntary shaking, or a part of your tissue in your hand or somewhere in the body, something is involuntary in a spastic stage. Okay, and these are the signal signs that calcium levels are low in your body. Okay, joints, it will affect the joints. Joints are people will not be able to be stretched too far. It will be in a flexed position, and their sound becomes very coarse and harsh even for females. Okay, because the larynx is affected, the sound box is affected. Paresthesia, paresthesia means loss of partial loss of sensation, etc., of the lips, tongues, fingers, feet may occur, especially in case of hypocalcemia. So these are the some signs and symptoms. It is given in the textbook. Just read through that. Okay? And there is also generalized muscle ache, body pain. Then coming to hypercalcemia, when there is excess amount of calcium ion in your blood serum. So this will result as an excessive dose of vitamin D. Okay, especially people who are vitamin D deficient and they are given the supplement of vitamin D to be taken on a weekly basis. But by chance, if they take it together or they misplace the dosing, etc., in that case there will be too much of vitamin D in their body, and because of increased amount of vitamin D there will be an increased absorption of calcium, and that's how they reach the stage of hypercalcemia. So it is best corrected by reducing the vitamin D content in the diet. Okay, do not reduce the calcium content. Even if the person is suffering from hypercalcemia, do not reduce the calcium quantity, reduce the vitamin D quantity. Automatically the calcium will come back to normal. That's the treatment which we give here. Okay, and yeah, what happens as the clinical signs and symptoms of increased calcium levels is you will mostly have anorexia, loss of appetite, nausea, vomiting, constipation, abdominal pain. The most common symptom is renal stones, kidney stones, increased calcium in your body, muscle weakness. Okay, and all these things can be reduced by giving the calcitonin hormone. Okay, we have discussed that earlier. Calcitonin is secreted by your thyroid gland, and it is responsible for the excretion of calcium from the body. Calcitonin will excrete the calcium from the body. Parathyroid hormone will increase the reabsorption of calcium inside the body. Okay, so they are opposites. Parathyroid hormone and calcitonin, they are completely opposite in their function. So coming to recommended dietary allowances, the main thing is for man, woman, and pregnant ladies, it is 1000 mg per day. But for pregnant ladies now, they are prescribing more than 1000 mg per day. They are not limiting it to 1000 mg. That's a change in practicality which we can see. In lactating women, 1200 mg per day. Postmenopausal women also 1200 mg per day. Okay, after menopause also your calcium intake should increase than a normal adult. So at the table you can refer for recommended dietary allowance, especially for man, woman, pregnant, lactating, and postmenopausal women. These are the important areas. Sources: calcium rich foods in India. A list is given even in the textbook on page 194. Okay, from the picture also you can see readily available foods, okay, which are cost effective. Also the cost factor also should be seen. People who are vegans, okay, who do not consume dairy, also you can get your calcium needs met by almond milk. Okay, almonds are also a good source of this calcium. Okay, and you can use almond milk and soy milk. Okay, they have good source of calcium, but it is not as good as the dairy product of milk. Okay, so that's a difference. It's good, but it's not as good as the dairy milk. Okay, and other cost effective non-dairy products, it is gingerly seeds, drumstick leaves. Okay, amarnath leaves, even amarnath beans are also quite good. Okay, rich in I don't know what you call amarnath seeds in other languages. Please try to Google that. Okay, it's a very cost effective way of incorporating calcium. Ragi, okay, ragi is quite cost effective. You can uh, give out the option of ragi for everyone from all the economic classes. Okay, quinoa, rice, etc., curry leaves. And dairy products, most of all the milk products, paneer, khoya, etc. Cheese also. Yeah, amaranth seeds. Amaranth seeds. I saw by mistake. I said amarnath. Sorry for that. I don't know what you call it in other language. So they have also in the textbook also they have used the same name. Okay, Rajgira. Okay. Okra, ladyfinger, bhindi. Okay, that is also quite a good source of calcium. Orange, instead of having orange juice, if you directly have the whole orange, that is much better option. And like exotic greens like kale, collards, okay, those are also quite good, but there is a cost factor to it when it comes to the Indian economy scenario. So drumstick is the best cost effective variant which you can prescribe to everyone from all the economic classes. So next, coming to phosphorus, it is a very essential mineral for your sustaining life, just like how important calcium is. Okay, the amount of phosphorus which should be there in the diet should be equal. Okay, can be a little bit less than calcium, or so it can be equal to the calcium doses, but it should not go more than the calcium intake. That's the main aspect here. Phosphorus can be equal to the calcium intake, a little bit less, but it should not be more than calcium intake, because that will create the imbalance in the serum calcium phosphorus levels, as well as it will interact negatively with the kidney reabsorption, etc. Okay, so the main functions of phosphorus, it will keep your strong bones, teeth, etc. strong and healthy. It will maintain the good energy levels because it carries, phosphorus is an important mineral which helps in carrying the oxygen towards the required cells and tissues. Okay, so that is why it helps in your energy levels. It forms the genetic material of your DNA as well as RNA. It helps your cell membrane, your cell wall to stay healthy. It keeps the function of your brain and the nervous system healthy. Even when you have deficient phosphorus, we have discussed that in case of deficient calcium, there is numbness, tinkliness, etc. But in phosphorus, we will discuss what are the signs and symptoms. Okay, it will come up. It will help to maintain a normal acid base balance pH level, normal pH level in the body. Helps in delivery of oxygen in the body. That is why how it helps with the energy levels also. So intestinal phosphorus absorption, is the image clear to you? Because if you want to understand the difference between paracellular and through the cells, is the image clear to everyone? Can you zoom it? Okay, so two way in which the phosphorus can be absorbed from in the body is this is the enterocyte. Okay, one enterocyte, 2 and 3. In the image you can see one whole enterocyte and 2 half enterocyte. Okay, enterocyte is your intestinal cell. At the end of the enterocyte, it is finger-like projections like villi that will help in the absorption of the nutrients. Okay, so in paracellular, you can see it is between the cells, between two cells, you can see a small space. So phosphorus will be moving from the paracellular, because even in the enterocyte, you have extracellular fluid here. Okay, extracellular fluid is present between the cells, and this extracellular fluid will help the phosphorus directly to go into the blood. You can see a small capillary forming here, right? In a light pink color, you can see a small blood vessel capillary. So even without going into the enterocyte, intestinal cell, between the space which is there between the intestinal cells, phosphorus can enter directly into the bloodstream. So that's what we call as paracellular absorption. Okay. And then you have active absorption, that is through the cells. There are protein membranes specifically there to push the phosphorus, pull the phosphorus inside the enterocyte and transport it through the cells and deposit it into the blood circulation. Okay, and that is influenced by this hormone calcitriol. Calbidin we have discussed earlier. It helps in carrying the calcium ion. Here calbidin will also help in carrying the phosphorus ion. Okay. Yeah. Now that was about the absorption. Am I audible to all? We had a power cut. There will be a network issue. Am I audible to all? Am I audible now to all? Is the screen visible? Am I audible to all? Is the screen visible? Am I audible to all? Is the screen visible? Is the voice audible now? Is it clear? Okay. Yeah, I just had a power cut issue here. Yeah, I guess network is re-established. Okay, so we have just discussed phosphorus absorption. Okay, now we will be seeing phosphorus metabolism. Okay, so from your diet, phosphorus has reached your body. Okay, and from here they have shown a hens intestine, but it's almost very similar with the human being also. So don't worry about that. So yeah, from the intestine it will directly go into the bloodstream. So blood will take the phosphorus to the bones, okay, where accretion and reabsorption will take place. And phosphorus will also, from the blood it will also go to the kidney, because blood has to undergo filtration. Okay, and depending upon the phosphorus level in the body, the kidney will decide, should we reabsorb the phosphorus into the bloodstream, or should it be excreted from the blood through urine. Okay, uh, yeah, and then phosphorus doesn't have direct effect on your parathyroid gland or thyroid gland. Okay, but the secretion of these glands in form of parathyroid hormones, those will determine how much phosphorus should stay back. Okay, because parathyroid hormone looks after for the calcium levels. If the calcium level is going down, parathyroid hormone will stimulate the kidneys to excrete out maximum number of phosphorus, so that the calcium ion stays back. Okay, so that's how parathyroid hormone plays its role in terms of in the presence of phosphorus. Okay, in bones, you know that it will help in the accretion, like growth and increase, and the lengthening of your long bones. Okay, and increasing in the width and length of your long bones, flat bones, etc. And reabsorption of phosphorus into the mineralization of the phosphorus into the bones. Okay, so this is how the metabolism of phosphorus takes place. Pretty much very similar to the calcium. Okay, it will go into mineralization, reabsorption, and everything, growth will take place. It will go to the kidney, filter out, or reabsorbed into the bloodstream will take place. And whatever is remaining, okay, after reabsorption, that will be excreted with urine. Okay, and even in diet, when phosphorus is not completely absorbed by the intestine, some amount of it, trace amount of it, it will be excreted from your body through your feces. Okay, so that's the metabolism. So RDA, it's around 100 mg per day for adults, very similar to calcium, but it should not, the amount of phosphorus taken on a daily basis should not be more than calcium levels. Okay, and but in infancy, when it comes to kids, infancy, we have a slightly different story. You can see the ratio here. Calcium to phosphorus ratio is 1:1.5. For example, just imagine if you are giving the infant 1000 mg of calcium, how much phosphorus should you give to the infant? In the chat box, can you say? Yeah, but you cannot give 1500 mg to a child. Just for an example, just a mathematical example I have given. For infants, it's the range of healthy amount of phosphorus, healthy dose of phosphorus on a daily basis is around 500 to 650 mg. Okay, so if you are giving 500 mg of calcium to a child, how much phosphorus should be given? 500 mg of calcium to the infant, how much phosphorus? Yeah, 750. Okay, when it comes to infant, this is the ratio. Okay, 1:1.5. Okay, yeah. And now coming to the natural sources of phosphorus for non-vegetarians, animal products, you have all the meat products, red meat and white meat, lean meat, all meat products, fish, and milk, okay, dairy products. Plant-based diet, sunflower seeds, nuts, cashews, nuts, all the dry fruits, and whole grains are good source of phosphorus. Coming to magnesium, deficiency is very rare. Okay, magnesium deficiency is very rare. So usually you will not see an isolated deficiency of magnesium. It will be around with calcium and magnesium. Okay, both deficiency will be seen. So that's how it is. Usually every time your body has around 20 to 25 mg of magnesium present in the adult human body, and out of that 20 to 25 mg, 60 to 70% of magnesium is found in your bone. Only 25 to 30 is found in muscles, soft tissues, extracellular fluid, etc. Okay, so that's how magnesium is distributed in your body. Maximum of it is present in your bones. So it is very important when it comes to the role of magnesium in your body. It is very important for a healthy nerve cells. Okay, maintaining the electrical potential, the health of the synapse of your nerve cells. That two nerve cells join each other. Okay, so there and all, it is very important. Muscle membranes, for healthy muscle membranes, magnesium is quite important. The recommended daily allowance for men and women, it is less than 500 mg of magnesium per day. For men it is 440 mg of magnesium, and women it's between 370 to 400, depending on if she is pregnant, lactating, or just a healthy adult. Okay, so you can see those charts in page number 199 about magnesium. So magnesium deficiency, isolated deficiency of magnesium is very rare. It can come along with some forms of inborn errors of metabolism. If somebody is suffering from inborn or errors of metabolism, they can see magnesium deficiency. They can come across these cases. And others, if they are deficient in calcium, phosphorus, and other macronutrients, automatically they will be deficient in magnesium. Okay, so isolated deficiency of magnesium is not seen. It is quite rare. Any doubt? Have any other